Hello, everyone. I think we're live. Dan Harrison here to talk with you. I'm actually speaking with you from my from Woburn. And I'm not on location, and I'm not in the office. Trying to provide a good example for social distancing. I'm sure many of you were feeling frustrated and continue to be in your homes and having limited access to the rest of the world. And this is, again, something like we've never experienced before. And we're all in this together because we certainly understand what this is doing to the broader population. Um, I have a few general thoughts, and then we're going to flip it over to Dan Lannon. He's standing by to talk with us about some of the specifics. But I first wanted to uh, mention a few things around the latest updates that we've received from the Commonwealth about the number of cases in Massachusetts. Governor Baker had a press conference earlier, and um, we now have 7,700, close to 8,000 of confirmed cases of COVID-19, with apparently around 122 deaths. Um, we here at NuPath have three of those confirmed cases, and we're waiting for the test results for, I believe, another four. All the reports are that this level and the number of confirmed cases are going to be increasing over this next couple of weeks in particular. I believe it was the governor that said today that he was thinking that April 10th would be about the point that we could expect to see maximum levels in Massachusetts. The governor cited a few reasons why we are experiencing lower than national averages, or at least in New York and some of the other hotspots. The fact that we have a lower population density than New York City, that we have a lower level of smoking among our citizens, which contributes to lower deaths of COVID-19, and that we were more quickly implemented social distancing measures that have helped to kind of flatten the curve on this thing. So those of you who are out there and wondering whether or not this is making a difference, it is. So don't smoke and stay inside if you can. And we're all going to do our part to uh, try to control the any new occurrences. But we are still in the thick of it, and we are working very diligently. Dan and his team have continued to respond to our changing needs and the demands of our population. Um, we know already that we are caring for people over at our home office at New Boston Street. Yesterday, I sent out a short video from that I took when I was at the Martin Center. We are, if there's any physical work that needs to be done, and in some cases there may be a few things that we need to physically be at a location, we will use this site, and that nobody is to be entering the location at New Boston Street. Nobody, except for the staff that are working there and the people that are convalescing there. So that's just as a reminder to everyone. Um, we are very fortunate to receive or to be eligible for some of the federal stimulus that's been made available to states, and that means that there is no employee of NuPath that has been laid off or furloughed, not one, in any department. This is something that is extremely important to me and to our team, and we're going to continue to move forward with the commitment to ensure that, is given everything that's going on, that we're going to be able to maintain employment for folks. So that's the good news. But just put some perspective to what is happening. Uh, the Department of Labor reported that 6.6 million Americans claimed unemployment benefits just this past week, and that broke a record that was previously set the week before, in which 3.2 million Americans claimed unemployment. and that is a high number. Back in the Great Recession in 2008 when it began, and some of you may remember that, but we had there was about 500,000 people, 500,000 a week that at the height. And so compare 500,000 to 6.6 million, that just gives it some perspective as to how much more far-reaching and widespread this is. And more people have filed unemployment in the first 2 weeks of this COVID-19 than filed unemployment in the first 6 months of the Great Recession. So again, just giving some perspective to what's going on here. We, I don't like to ever find myself in a position where I try to say, let's be grateful for what we have. But if you're part of NuPath and if you're continuing to get your paycheck, we should all be very grateful, because we have many of our fellow citizens across this country that are not, across the world, that have not been so fortunate. And we're going to continue to abide by our commitment to our family and to our united force, that we're going to get through this together. That's so essential. And some of the details that are contained in the CARES Act, we talked about that the last time. We're still trying to tease out and understand how it's going to affect us. So I know there may be questions that some of you have about whether or not you need to use your sick time, or is it fair that your benefits are being utilized for this time. We will sort all of this out. And if you are asking HR for an answer and they don't have it immediately, again, I just ask that you please be patient, and that you give us the time we need to work out everything that we need to understand in order to ensure that everybody is able to take full access of every benefit and every part of the stimulus package that's come down. Guys, I only want the best for everybody. That is my fierce and complete conviction. If you don't know me, then I guess I'm going to have to ask you to trust me. If you do know me, then I would ask that you base your hope for the future upon my past performance and my past my past commitments to staff. And even though I don't have the same kind of individual touch points that I once enjoyed when I was at an earlier time when this organization was much smaller and I had a different position, I assure you that I do care about every person, and we're trying to get through this together in a way that keeps all of us whole, and that everyone is able to move beyond it and maintain their financial stability. More importantly, that we do it all alive, and that none of us are succumb to what this terrible virus can do. There's still so much that we don't understand about the virus. I'm no epidemiologist, I'm no scientist, I'm not a doctor, so I cannot provide actual facts about the progression of this, but there's just so much that is still not understood. Some people that get this remain essentially symptom free. Right now, the guys that we have over there, over at 147 at our care unit, they're not showing symptoms. They seem to be perfectly fine. And then you hear other people, not even necessarily older or chronically ill, people that are in their 30s, 40s that are struggling and fighting for their lives right now on respirators. So we just don't know how this virus really works and how it translates into some of the impact that it can have on people's health and their and the mortality rate. So the best bet is to just not get it in the first place. And the best way to do that, because we don't have a vaccine, we don't have any medication that is going to make things better, is to limit your exposure. Now, that's good for a wide swath of our family. Hopefully, our staff that are not currently being called to duty are not going in every day and working with our folks, your best bet is to stay inside your home. And if you do have to go out, make sure that you're abiding by every protocol that has been recommended. Washing your hands and keeping a distance, and avoid touching surfaces, hard or soft surfaces. These things you've heard 1,000 times before. Um, but the social distancing angle is definitely something that's continued to be a part of our landscape and a part of our shared experience going forward. And there's no other way around that. So if you're staying locked down and staying inside, good for you. And I have begun to accept the fact that I'm going to need to um, eliminate some of my visits out and my desire to kind of have a public face in our program setting, because I want to urge all of you that can to do that. Now, for the staff that, because we're essential workers, that do need to come in and that are scheduled for shift, we thank you. We thank you eternally. I have gotten so many emails and texts from various family members that have expressed their deep appreciation. I talked to family members who have people that are currently over at 147 because they tested positive, and they have thanked me, not me because it's you, but thanked us for all that we're doing to ensure that our people are safe, that their health needs are being cared for in this desperately uncertain time. And so to those staff that are caring for our population today, tonight, tomorrow, whether they be day or residential, whether it be your program of origin or you've been mobilized into a particular program, you are making us all very proud. And when I tell you that it is my full intention to do everything we can to honor and respect and understand your your sacrifice, the fact that you're coming into work every day and getting paid for that, but some of your colleagues are not working or not coming in and they're getting paid. uh, I want you to know that your service is so meaningful, and I am so personally deeply grateful. And on behalf of the board of directors, we all are relying on our workforce to remain accessible, to remain willing to step forward and care for our population, because our people are vulnerable and they are in their homes and they're not able to leave, and family members are trusting us, they're depending upon us to ensure that their loved ones' needs are cared for and continue to be monitored in the highest and the safest and the best way. So, to all of our staff that are going forward, that are working with our people directly face to face, we're going to be uh, begin paying a $2 an hour stipend for all the work that you're doing. We're going to make this retroactive to when this sort of all first began, and we want you to know that that this will continue. There may be modifications, and maybe we'll start to pay more if this crisis continues. But we want to let you know that this is our way of valuing the work that you're doing. Yesterday, when I did my video at the Martin Center, I said that there would be details to follow. And if you look down in the little side panel, someplace on your screen, there's a a section that says attachments. And right now, there's one attachment that says NuPath staff family. No, I know, or maybe that's it. Client virtual town hall. There's an attachment someplace if you look, or handout that expressly goes through the details of what the compensation is going to look like. So for residential or for day staff that are working directly with our clients face to face, there'd be a $2 an hour stipend. That's for salaried, that's for non-salaried, that's for anybody that is coming into contact with people, whether they're documented to be positive or or not. Um, and then for the group of people that are really stepping out and and sacrificing in their own, the threat to their own safety and well-being. The people that are working over at New Boston Street with the folks that have tested positive, we're going to be increasing their compensation, because as we've done a little bit more thinking, and as more of the details surrounding the mitigation money in the CARES Act has become more evident, we felt that we wanted to put the maximum level that we could into our compensation for those people. So for anyone who is doing that work and providing that service, we're going to be paying time and a half for the whole 84 hours that your shift would be for 7 consecutive days. And then there's going to be a $500 weekly bonus. So we know that the money can't make up for the threat of getting ill, but we want it to be a symbol, our commitment to you all that are making this commitment, and it's so important at this particular time. If you're somebody that's interested, or if you've expressed an interest in working in the programs, Dan will talk to this probably in more detail, but be patient if you haven't been called just yet, because we're on this weekly cycle. We are going to be needing more staff to replace the staff that are cycling out. Some of you may already have been scheduled to fill some of these shifts, and but we're also having to remain prepared for our occupancy, if you want to call it that, our number of cases as they increase. We may need to bring more staff on board to care for these people that have been diagnosed with the coronavirus. And so right now we know what our ratios require from a staffing perspective, but that may change and that may increase. So what we really want is for a group of people to be on this kind of waiting list. And Dan and his team will make decisions about how to select people in the most fair way. If there's numerous people that want to participate in this, based upon experience, the population, the clinical needs of people, and how we can help everybody there to be well fed and have all of the basic comforts they need in order to weather the storm. This is well, it's getting repetitive for me to say this is not like anything we've ever dealt with before, but it is, and we are keeping our laser focus on how we proceed. I've said it before, but we have got a talented team of people that is being led by Dan and Sharon Pitts, who just deserve the highest praise from all of us for your work in protecting the safety of our people and in helping guide us as an organization in our response to how do we meet the needs of our population, how do we meet the needs of our families, and how do we move forward in a way that's going to guide us out of this terrible experience. Last thing I'm going to mention, and then I'll flip it over to Dan Lannon. We are in the process of exploring. I've said this before, but exploring ways that we can help our people that are been displaced because our day programs have been shut. I've said it in previous broadcasts, but I know what a kind of a crushing demand this must be for some families to have your kids home during this time, and looking for activities, ways to keep people busy. And we've got a team of staff that we're assembling to begin to provide some virtual outreach. We had a job camp earlier, I think it was today. Brian Ellsworth and some other people on the job coaches and the team of job developers are kind of repurposing their influence and how they are going to be able to engage a population of people that are probably trapped in social distancing in their own homes. So we are preparing for this to be something that goes well beyond an April 10th date. We're by all reports, this is something that's going to go well into May, if not even into June or July. But the purpose of all of this is to stop this virus and to get a handle on it nationally, so that we can uh, ensure that the hospital capacity is there for those that get desperately ill, and that we're able to at some point return to normal life until a vaccine can be developed. Tomorrow afternoon at 3 o'clock, we are going to have our virtual Unity Forum. As a reminder, we had our first one last Friday, and it's a chance for us as we go into the weekend, whatever the weekend means anymore, and to hear from some different parts of our great organization. And these are staff or people that are one way or another involved in various programs, helping us get a perspective of what some other people may be going through, to have an appreciation for the various challenges that our colleagues are enduring right now, and just to see some friendly faces of people that are out there. Tomorrow we are fortunate, and unless some other state house business takes them away, to have Rich Haggerty, who is a state representative here in the Woburn area and happens to be my state rep. Rich has been a friend and a strong supporter of the disabilities community for years and years, and we know that I was in frequent contact with him, and we were fighting last week to ensure that we got funding in order to keep all of you employed. So you have good reason to want to hear what Rich has to say, and that we can thank him collectively for the work that he did in ensuring that we had the money that we needed to keep everyone whole, and to keep you all paid, and to make sure that that's one less stressor that you have to endure. I'm just very happy that NuPath staff is not part of the 6.6 million people that found themselves unemployed last week. And we're going to continue to ensure that we do whatever we can to maintain that employment. So stay strong, everyone. I'm going to remain online after we bring Dan Lannon in. And if there are questions later on or now, I'd be happy to answer them. But if not, we'll hear what Dan has to say about what, if there's any current details that people need to be made aware of.
There I am. Hello, Daniel.
Hey, Dan, how are you?
I'm well, thanks. How are you?
Great.
Excellent, excellent. So thank you for that update. I guess I'm going to sort of talk more like we have been about the safety procedures we've been taking and the protocols that we're continuing to have run and put in place at certain locations, and also talk about the care center and the residential components as a whole. I think one thing was great to hear, and I know a small group of us met on it yesterday, was that we wanted to really recognize those staff that have stepped up and continued to cover shift, both from the residential and the day component, as we go through this. And certainly we focused a lot on making sure we had enough staffing and enough PPE equipment for the care center, and we also have that rolled out at the houses, but really wanted to just to do whatever we could financially to thank those staff. And I think as we learn more from the CARES Act, we were able to get that out there quickly to staff and to retro it since this time began. So that's exciting. I can report that everyone is doing well at our residential programs as well as the care center. We are still waiting on results for the 4 individuals I mentioned the other day that we were trying to get tested. We got them tested, and we're still waiting on the results for them. The care center currently has 3 individuals living there. We continue to monitor the temperatures twice a day for the individuals. Also staff every time. Once a day, we're monitoring their temperatures upon arrival of the shift. We're also asking other staff at our residential homes to take their own temperature before they leave for shift and monitor their temperatures, because we just don't want to put anyone at risk. And so even them, if their temperature is high when they're leaving their house, they can just call and let us know that. They shouldn't have to drive into shift and have us take their temperature to sort of to prove it, I guess I'm saying, because I do think this is a time when everyone has to, we're trying to get everyone all resources to take care of the individuals and make sure that we can maintain health and safety with them and practice universal precaution and wash our hands and keep social distancing. And, at that same time, everything we talk about that we're trying to say we're doing with, our individuals, we need to be instilling that, you yourselves are doing it, the staff that are here listening and working these shifts, that you should be taking your own temperature, letting us know if you have a raised temperature, letting us know if you had worked with someone or been, around someone that had been tested positive, all of those things. And so that right there is work to keep our individuals and people safe. And so we have, the cleaning continues to be really ramped up at the New Boston Street location. We have cleaners coming in, disinfecting and doing deep clean to the area. We also have the deep cleaning and disinfecting happening at residential homes on a continued basis. We started that about 2 weeks ago. So I think some of these measures, putting in, that cleaning very quickly from a company that has experience in doing that and can do that and is following the CDC guidelines, as well as, really encouraging people to practice social distancing, wash their hands, use universal precaution, and keep gatherings as small as possible. I think all of that, that is helping us through this and making an impact. And so we want to continue that. The temperature checks, certainly, day one on that Friday when we decided to make the decision to close the day programs, we had already started with the temperature checks at the residential components. And I think all those things are things we just want to continue to do, to monitor, to stay vigilant with. I don't think we want to, we don't want people to get in the habit that this is, that somehow it becomes, less of a priority. Is still a huge priority, as we know that from what Governor Baker said, that Massachusetts numbers have been a little low, I think, at first than they anticipated, but he also expects that surge to be coming over the next 2 weeks, and so therefore, us having just what is 4 individuals having tested positive, we wish no one tested positive, but we think we're doing a good job in communicating and keeping those individuals as healthy as possible and safe as possible, and making sure that they can return to their lives as soon as possible. So as far as getting back to the staff are also doing at these locations regular cleanings as well, in addition to the cleaning that the cleaning company is doing. And so I think this is important to know. A parent actually, we asked about that, and yes, the staff should be doing that as well. We've also, as we mentioned last time, we have as of now a very adequate supply of PPE equipment, and we have masks and gloves and that rolled out to the houses, and then the PPE equipment, which is recommended for working with someone who has tested positive at the center at New Boston Street. So we're just continuing to communicate, to monitor the individuals, to monitor the staff working with them, and really today we don't have much of an update as far as changes in staff that have tested positive, individuals that have tested positive. That again continues to be sort of a fluid situation, but there has not been much change in that since we've talked. I think that was, I lost track of days here, on Tuesday, because it all has seemed like one continuous long day. And so, that's about it from me. I don't really have any great updates. I do think that the $2 an hour incentive for staff, we just want to really say thank you and want to share that with you as soon as we could and get that out there. I know parents have, a lot of parents have emailed in or texted and just said thank you and shown their support, and we really appreciate that. It's not the ideal situation, I think, that any of us would have wanted to go through, but I think the early stages in planning that we did ahead of time and trying to make decisions swiftly, even before we were in real need of that, has helped with being able to feel this, I don't want to say prepared because if we do see a surge like the governor was talking about, and certainly we will respond to that, and we have plans in place to be able to handle that. And so I do think recognizing all the help from everyone who has helped out covering shifts at the residential programs, day staff that have come in to do their work, people that have stepped up and handled the center, the team of that James has put together to help with the online classes and programming and activities. Job camp today, that was just one. I know that there was a Zoom meeting going on earlier today. I think the more and more as we expand that, get the message out there, to people. We are trying to get an inventory real list of what, if you have a son or daughter at home and you want them to participate in the class, and it's a 3 or 4 hour activity, and do they need headphones? Are there certain things we can help out? We're asking staff, and you might have received those calls, to just call and check in and see what the needs are and see what the capacities are, see what equipment you have, so that we can try to get the best platforms for the activities that we're talking about. And we have tested a few of them on smaller groups, and some seem to have really gone well. And we're looking to roll out a number of different things as far as guest presenters and different activities. And so the little feedback that we've gotten so far has been great, and we expect to really ramp up on that. I think a lot of people saw quite a bit of an increase in that today, and you'll see quite a bit more on Monday. And so if you haven't been reached out to by the staff that you're familiar with, or by the manager of the program that your son or daughter attends, then please, you can certainly let me know, or certainly let the manager or director that you usually deal with know. And at the New Boston Street location, that would be James Sannon. The Westford location, that would be Brian Calnan. I always call him Callahan. It's Calnan. And sorry, Brian. And then at the Martin Center, Justin Belmonte. As many of you know or didn't know, and I know the message went out and the timing just was not ideal, Matthew Avery has left us. Matthew was with us for 14 years and has left and taken a job for the Merrimack Valley Department of Developmental Services. So we'll certainly see him around, and I'm sure he'll have some people that attend our programs on his caseload. And so if he's watching, hello, Matthew, and thank you for all your years of service. But Justin Belmonte would be your best contact for that. But if you're used to dealing with Rosalinda or a direct staff person, certainly reach out to them, and they can certainly help facilitate getting you on the list and getting you involved, and finding out what equipment and things you might need. We're also doing sort of a health status check, like a triage, to where staff are calling. They're going through a series of health questions, even if your son or daughter lives at a residential program or they live with you. These are just general series of questions. If some of the questions would trigger more follow-up needed, then the nurses will following up on those immediately after. So we just want to make sure that everyone, not just those in a residential component right now, but everyone that is part of the NuPath family has the resources and are getting what they need during this time. So that's about it for me. Greg, I don't know if there's any questions. I'm looking at my question screen and I don't see any, so that's good, I think. But if you want to bring Dan back in, or if there's anything you have.
Sure, Dan, sorry. There's a number of questions that I can share with you. I can read. Just one point, Dan Harrison had mentioned the handouts. So folks watching on a desktop or laptop, you can see that on the right-hand side. If you're looking at this through a phone, then just click on the 3 dots more, and that will actually bring you to the handout that gives details on the residential shift and care center details. So be on the lookout for that. And so we have a number of questions. First one is, and this comes from a parent, in your opinion, how long before parents can visit their children at the residences?
I'll let Dan take it then.
That is, thanks, Dan. We were on a call the other day with DDS, the Department of Developmental Services, and that question was asked of them, and they said that they did not have a timeline for that guidance, and it actually spawned into a deeper conversation about one vendor who is out in the Western Massachusetts who they were in a series of their 5th house being quarantined, and their quarantine periods have lasted from, at that point, they were over 14 days for this one particular house because of the rollout of the first person getting it to when the last person got it. And so there was no clear answer to that. And so therefore we're sort of bound by what their recommendations are. We don't feel that we would even without their recommendations or without their suggestion right now, we don't feel like we would lift that with any of our houses, knowing how much we've tried to really keep track and closely maintain anyone that has any interaction with anyone in our houses. Anyone that has taken a shift at a particular house only stays at that particular house to work that shift so that we can try to minimize the exposure. There is, with so many of staff of ours who have families of their own, have loved ones of their own, work other jobs. We really want to, we have a questionnaire that they fill out so we can try to maintain, limit the exposure. And so there's no clear timeline for that.
Those of you who've been following CNN or probably just about anywhere, Dr. Fauci from the CDC has become a bit of almost a national hero in his leadership of the medical sort of impact of all of this, understanding the trajectory of this virus or this pandemic. And he was talking earlier, and he said that he will begin to feel that he could relax, or that some of the restrictions that have been around our social distancing can be relaxed once we start to see a decrease in new cases that are diagnosed. And then what they're calling this lagging indicator. These are the number of deaths, because the number of deaths that occur based on this virus or from this virus, sometimes it could be later because it might take people a while before they actually succumb to the disease and die. So that sounds a bit gruesome, but I think so much of this is going to be based on the best guidance that we receive from our state and federal officials, people that will help us understand when the time is becoming more safe to begin to increase some of the contact that we've been really that's been eliminated from our daily lives. So I don't foresee NuPath making any unilateral decisions about welcoming families back into our homes until we have received more of a more central kind of guidance about whether or not that's safe or advised during this thing. So we're really trying to take all of our guidance and from people that are much that are much more in the thick of what's going on a national level and on a statewide level. And when we hear from the federal government or from Governor Baker that we're relaxing some of these things, I promise you will be the first to know, because I know this is tough to not have contact with your children. To that end, we're trying to increase our ability to give heightened access through Navigating Life and some other forms that we have, whether that be Skype or FaceTime or other ways that people can stay connected. If you feel that you're not able to connect with your children virtually, then please let somebody know, because if you're not able to, then that means there's just been a breakdown in our communication or in our technology, and that's something that we want to rectify. So like Dan said, we don't know, but we're going to be taking our guidance from experts that can advise us on how our decisions will impact the greater sort of goals of all of us in the United States to end this virus.
Greg, I did see the questions come in now, so maybe I'll just try to go through a couple of these. I see 3 for me that I think I could answer, and if Dan, if you want to expand on any of them, maybe you can afterwards. But so the second question was, will the compensation that has recently been announced be made available to those people who had volunteered before we decided on this compensation for the care center? Yes, so this will be retroed back to anyone who's signed up or who is working at the care center right now, as well as retroed residentially when we from the onset of this epidemic. And so yes, our staff at residential homes wearing masks and gloves. My son requires a lot of hands-on care. Yes, so gloves and masks and that equipment is very ample at the houses. As I mentioned the other day, we have another supply coming in. I think that's coming in on Saturday. And so we really decided what we really wanted to do is, I know the recommendations at first were, only people that has showing symptoms or had tested positive or been around someone who's tested positive should wear a mask. We got feedback from our staff that hospitals were all wearing masks. Every person that was working shifts and everything, and our staff felt more comfortable wearing masks while on shift. And so we've made those readily available. So yes, the answer to that is yes. My son lives with one of the men who tested positive and is currently at the center. Will his other roommates be tested? So this is the part of a challenge that we're having, and we recently got communication yesterday from the town where one individual who tested positive moved into the New Boston Street Center, and we asked the board of health if they could help us try to get the rest of the house tested. They don't have this lag time of different people coming in testing positive like we experienced at our first house. And that is not what they're doing. They will not approve that. And the only people they are testing are people that are showing symptoms, and they are turning people away at the testing sites if you do not display or have a doctor's order or showing those symptoms. And so unfortunately, we are going to go back at that again. We've asked DPS for if they could try to help us facilitate that for those residential homes. We think that that's important. I mean, if we look at the one case that we know an example of, and if we listen to, one thing I will say is, if we listen to the providers from New York who are in our field, or from Washington and even Ohio and some of those other locations, is that, they're pointing to the same thing we realize at the first house where we've had someone diagnosed positive, is that from the time the first person diagnosed positive until the time you have that last person possibly diagnosed positive in that house, that could be the 14-day period there. And for those people that are in those houses, their quarantine then is turning into 28 days. And our whole desire with trying to develop the center and have people be able to switch there for their recovery phase was so that as soon as they can, as soon as their quarantine period or as soon as their isolation period is over, that they can get back to their normal lives at their house, knowing it has been thoroughly cleaned, deep cleaned by the professional cleaning company, that the other people in their house have tested negative for the virus or have not showed any symptoms and everything. And so that was our real desire, was not to have them have to experience this waiting period for the other individuals in the house to be tested. And we heard firsthand from a provider in Massachusetts, out in Western Mass, where his quarantine period, as I mentioned earlier, for one of his residences was running over 20 days now because of the different times of different people coming in positive. And so unfortunately, we can't get that whole house tested even with one positive person. And that's just something we're going to continue to work on as we go forward here. So, Greg, those are all the questions I see. Dan, I don't know if you want to expand on any of those things.
No, I think I think we're good. We're moving forward, and Dan, thank you very much for for supplying some of the additional details. We need everybody to be doing their part right now, and I know I can count on all of you to help us get through this. We got this. We're going to do this. So log in tomorrow for our 3 o'clock. It'll be great.
All right. Thank you, everyone. Wash your hands. Keep social
Thank you.
distancing.
Wash your hands. All right, guys. Thank you.
Thank you. Take care.